When we first started thinking about, the collective consideration of the childhood dementia disorders, we really wanted to understand the magnitude of the problem and whether it was something worth undertaking. And we tried really hard to find, literature and information around the collective numbers, and we actually couldn't find anything. We found some papers that had been written that defined childhood dementia, and we found a lot of papers that had been written by the individual around the individual conditions that referenced them as childhood dementia, but nothing that really quantified them. So we commissioned a burden of disease study, which was undertaken by Thema Consulting on a pro bono basis. And the results of that were published in a paper that was released in October 2020. And some of the statistics you can see here. So there were identified 70 different genetic conditions that lead to childhood dementia, and we're actually going through a process which we'll probably do annually to review that number, and so we know that that will increase. But at the moment we've identified the 70, and the vast majority have no treatments. I think something like less than 5% currently have a treatment today. 1 in 2,800 children are born with a childhood dementia disorder, and if you put that into context, better known conditions like cystic fibrosis have a similar incidence. One of the shocking statistics was the death rate. We lose about 90 Australian children every year to childhood dementia disorders, and that's a similar number to the paediatric cancer cohort in the 0 to 14 age category. Life expectancy for 75% of children with dementia is less than 18 years, and as you saw in the video earlier, globally that means every 11 minutes. And the economic cost was calculated at 389 million or 3.9 billion over the next 10 years. And just to frame that, it was a very conservative estimate because there was so little data and literature available. So that's a number that we're going to watch and continue to update over time. So the childhood dementia strategy and the approach that we're undertaking, this is the simple version. Our purpose is we want to transform research care and quality of life for children with dementia so they may live long and fulfilling lives. And the little flywheel diagram there describes we're focusing on the commonality instead of the underlying genetic cause of the dementia, and that commonality is the dementia. In doing this, we can raise awareness, we can accelerate therapeutic development, and all of that will lead to better care and quality of life. Now, this is the more complicated version of what we're doing. This is the model that we're working towards over the next 2 years to deliver on that. We've got 3 segments of work. The first in the top, the pink-purple colours is the better care and quality of life. One of the key challenges we currently have is there's very limited data available, and there's certainly no collective studies of the psychosocial impacts of childhood dementia. We've initiated a partnership with UNSW to understand better the psychosocial impacts of childhood dementia. We're currently doing a literature review, and we're also putting together a consortium of partners to really uncover this and look at it in a lot more detail. As part of that particular program, we'll also be undertaking a review of the health and social systems to see how those needs of families are or aren't met. These 2 pieces of work will then inform a national framework for care for childhood dementia. We're also putting together a care alliance which brings together parties from across the spectrum of service providers who are working in the childhood dementia space, and this will include disability, palliative care, children's hospitals, dementia specialists, and various other paediatric health specialists. And this group ultimately will become the champions for change to drive for better care and quality of life for kids with dementia. And finally, in that segment, we've got the health professional education program. We're developing material at the moment, and the video that you saw at the beginning is actually our first output from that project. Ultimately, we want to see that embedded into the health systems training for health professionals. And therapeutic development, which is where we're focusing today in the blue section there. First of all, like with better care and quality of life, we need to build the body of evidence. We need that foundational evidence to show that this collective approach is a good idea. We've got a couple of projects that we've initiated in that space, and the first one, actually, Chris can show you today if you're interested. We've built a knowledge base which has all of the 70 plus conditions with various data elements associated with it. And we've included externally sourced or linked data so that we can aggregate and interrogate the database to look for commonalities. So for example, which of the conditions present with a particular disease mechanism or a particular symptom. So we think it'll be a really rich data source for researchers in particular. And we've also begun a benchmarking study working with Research Australia to really understand where there is activity happening primarily in preclinical and clinical trial around the world, which will allow us to identify where there is interest in the field, but also provide a basis for horizon scanning moving forward so that when clinical trials are coming through the pipeline, we're able to see that and work towards getting those attracted to Australia so that kids can access emerging therapies on clinical trial. And the symposium today is the first, we hope, of a series of symposiums bringing together people who are interested in working in this space from across the board. And we're also putting together a research alliance, and you will be followed up after this conference today to join our research alliance, which is all about enabling collaboration, fostering knowledge, and really sharing across the field of therapeutic development. And finally, the awareness and advocacy. Gail has already talked about the importance of family voices, and it guides everything we do. We have got an advocate model, a consumer network. We're running a series of focus groups. The first, we've published the outcomes of, which was palliative care, and we're about to publish the second outcomes of that focus group, which is what I want my health professional to know. I think we actually have versions of the palliative care communique here today, which are available if you're interested in that. And general awareness, the fragmentation of the childhood dementia disorders means that, generally it's so difficult for us to attract funding and get movement on these disorders because people don't understand or know about this group of disorders that have been focused on as a singular. So that's our detailed delivery model, and I've said we quite a lot. This is the we. We've implemented a governance model that includes a board of directors, a scientific and medical advisory board, and strategic advisors, and many of them are here today. And we also have a very strong team, all of whom are here today. So we'd love for you to get out and meet each of the team and talk to them. And finally, I just wanted to thank our sponsors of this event today, Sanofi, Alexion, Illumina, and of course I wouldn't be doing my job if I didn't point out there's a QR code here on the screen and also in the programs in front of you. If you have the means, we would love you to donate to our cause. We're a charity after all.